Let's talk about using a menstrual cup. So many of my patients are curious about these, but a little intimidated. So let's talk about how this would work. The product we're going to use for the demo is by Forever Radiant. It's a really high quality menstrual cup that I recently got a sample of. I love it for two reasons. One, it's made out of a really high quality medical grade silicone that's not going to degrade over time. It's going to last for you. And two, it comes in 3 different sizes. So the cool thing is you can really size it to your body. Insertion can feel super intimidating, but it's really no big deal. It's one of those things that once you've done it a few times, you're not even gonna have to think about it. These cups are super squishy, so I would recommend folding them in half and then in half again, and it will end up in this nice little compressed size that's truly no bigger than a tampon. Once it's compressed and ready to go, it can be inserted into the vaginal canal. Some folks like to put a little bit of extra lube on the outside of this before the insertion, but if you do, I recommend using a water-based lube, not a silicone-based lube. You can't put silicone lube on silicone products because silicone will degrade silicone, especially if you're using a lot of it over time. When you're ready to put this in, just go into a bathroom or a private room, you squat down a little bit and truly just stick it in with your fingers. So you place it inside your vaginal canal, and then you can use 1 or 2 fingers to try and push it up toward the back if it doesn't feel like it got in far enough when you initially stuck it in. Once it's in place where it's supposed to be, it should just pop open. Even though it went in compressed, it will pop into place, as you can see this one has, and then it's ready to catch your menstrual blood. So it'll literally sit like a little cup underneath your cervix, which is the door to the uterus, to catch any of the blood that is falling out. If you feel like it hasn't unfolded completely, sometimes if you twist it a little bit, that'll open it up, pop it open so that it suctions right into place. Removal can take a little practice, but once you get the hang of it, it's no big deal. You're gonna stick 2 fingers inside your vagina while you're in the bathroom, and you're gonna give the base a little squeeze. Squeezing releases the suction. Once the suction is released, it should slide right out. Once it is out of your body, it will be full of blood. You need to dump that in the toilet, give it a rinse in the sink, and then you can put it right back in.